Hello and welcome to Issues and Answers, a production of the Government Information Service and NTN. I am your host, Kendall Eugene, and with me today is the Director of the Universal Health Coverage in St. Lucia, Dr. Lucia Eugene Ford. And we will be discussing, among many topics today, the new testing method for cervical cancer and HPV screening. Dr. Ford, welcome to the show.
Good afternoon, Scotty. Good afternoon, St. Lucia.
Before we delve into the new testing method, very interesting and interested to hear about it. Let's talk a little bit about something that I had the opportunity to speak to you about a few years ago. I think it was 2022, and that is UHC. I know the rollout, how it started, but can you give us a brief update on it, especially with regards to the maternal and child health services?
Yes. Okay, so I think on your show, back then I met in 2022, later in the latter part of 2022, and we met again in 2023. When we met in 2023, we were speaking about the launching of the first clinical service under the Universal Health Coverage, and that would have been maternal and child health services, where any woman that was pregnant, any woman, she could have accessed the wellness center and was able to get all the free labs that you get during your pregnancy, as well as the ultrasounds that are necessary throughout the pregnancy. And this started in 1st of June 2023, and I have data now that I could tell you when we compared June of 2023 when it started to March of this year, compared it to the year prior of June of 2022 to March of 2023, when the services of labs and ultrasound was not available. They were not available. We would notice that in the year of 2020, when we started, 2023, when we started the service, we had 1,281 new clients coming to the wellness center. These are pregnant women. And when you compare it, or you put it vis-a-vis the year prior, when these services were not available, then you had just 951 women coming. So with the insertion of these new services, the diagnostic services of labs and ultrasounds, we would say that we have an increase of 330 women compared to 1 year compared to the previous year, which actually is about a good 74.23% increase, which is something that's good.
Yeah.
Okay. We can clearly say the number of women that actually came. We had about 1,719 women who had ultrasounds done, and about 1,375 of the individuals came for routine lab tests that are done during the pregnancy. So women did take advantage of the services that are provided under Universal Health Coverage. I want to tell you that we still have to do further analysis of our data for us to be able to see the true impact of these additional diagnostic services, because we have to see whether or not really we were pushing to see good mortality data from these women and coming out and babies coming out, because these lab tests and these ultrasound tests, we're really supposed to see if there's an issue with mommy or issue with baby while baby is developing within mommy's womb. So if these tests were done and the ultrasounds were available, then you're really supposed to have had the ability as a midwife or as a obstetrician gynecologist or any general practitioner who's taking care of the pregnant woman to be able to do the necessary interventions. So we will want to see later on with time what our birth rate looks like and how mom is coming out of it, and babies, especially now that it's been a year from launching into now.
With all of the data that you will be collecting, or you have collected already, would you consider the program to be one that you could give a passing grade, a successful grade?
I think yes. But as I said, to be able to complete the scoring sheet, we really need to see what mommies and what our maternal and neonatal outcome is like, you know, morbidity, mortality, to see. So this is data we get from the hospital after mummies have actually delivered, to see what it's like. Was mommy healthy? Is baby healthy? Or are babies healthy? Because if it's a gestation with more than one baby, we have to look at that as well. Importantly as well, we have to find out, because maternal and child health services, there were trainings that we did to allow us to be able to launch, and that would have been services such as dealing with the complication, whether it's maternal and neonatal complications. To break it down, dealing with mommies and babies that are complicated during the pregnancy, especially during delivery. And that training was done for primary health care as well as hospitals. So we also did softer skills training, where patient satisfaction training was done, because we could have really do well clinically, but if we don't have the softer skills, we have a problem. Because you know, that's important. So for me to be able to say, or for Ministry of Health to say that this program was successful, we have to measure the satisfaction level of persons who went through the system. Because any pregnant woman would tell you, well, I got the lab, I got the ultrasounds, but I didn't like the way the nurses spoke to me. I didn't like the way I was treated on the ward when I got to the hospital. So to be able to really measure how impactful and how successful that program was, we have to see how the patients felt at the level of the primary health care and the level of the hospital.
So it's not just about providing the services, but it's also how the patient is treated. While
the softer skills, which would make a huge difference. So we have to take that into consideration. We do have surveys that we send out at the level of primary health care, but in order for us to get a true picture, we can't just look at data and say, okay, we have X number of women that have delivered X number of babies, and you know, we had no deaths, or we had no neonatal deaths, and all mummies were okay. But we have to see, were the patients satisfied? Did they feel that they are satisfied with the way in which people were speaking to them and the way in which people were treating them? And that is important as well.
Looking at the data, especially from 2022 to 2023, June 2022 to March 2023, we saw, like you said, 951 mothers or expectant mothers turning up for the service. And then we saw the increase after the ultrasounds and labs were introduced. Do you think that is an indicator that mothers were staying away from hospitals before UHC was introduced?
I wouldn't say away from hospitals, but what I could say is that there's a cost associated with paying for labs during the 9-month gestation. There's a cost associated with getting an ultrasound done in each trimester. The 3 trimesters for the pregnancy. Sometimes a mother may warrant more depending on her condition. She may need extra tests depending on her conditions. She may have comorbidities as well. So mothers, women, may not necessarily have the money. So it's a situation where you have a woman who may very well be pregnant, and she would have 2 or 3 children that she has to feed. So she would say, you know what happened? I want to feed my kids that I'm actually seeing all the time. And then I'm not going to do the test. Not that she doesn't want to do the test. She has to divide her small pie into pieces, and then she plans to prioritize. And to her priority is to give it the children that she's seeing every day that needs to eat. And the child who's inside her, that's growing up. Well, as long as I eat, the child will eat as well. That's how some parents think. Mothers think. So having these services now available at primary health care, or through the wellness centers rather, at no cost to the patient. These individuals that had to be choosing or prioritizing the little money they have, they don't have to worry about that anymore. They didn't have to worry about that. They don't have to worry about that anymore. So they could easily come to the wellness center and say, listen, I could take care of this, and then the labs could be done, so the doctor or the nurse can get a better idea of how you are clinically as a woman. Your ultrasounds to see how baby is developing within your womb. So these are things that would have encouraged the women to come, and women, if you're getting it at no cost, why not go and take advantage of it, especially if you know it's needed, and it will give a better outcome for your pregnancy, for you and for your baby.
Are the services available island-wide or at specific wellness centers?
At all wellness centers, you can go and they will be able to give you guidance through. So yes, we did mention that we have sites, 17 sites, of which all of them around the island, where the phlebotomist comes, which are the people that will be withdrawing the bloods for you at the wellness center. And you obviously, at any of the wellness center you go, the nurses tell you, listen, we have the phlebotomist coming on Monday, or the phlebotomist coming on Tuesday or Wednesday, or the phlebotomist will be in this next well center, which is not a stone throw away on a Friday. The nurses will inform you. And they will also tell you as well, if you need an ultrasound, they'll give you the USC voucher, so you can get an ultrasound at any of the ultrasound sites in St. Lucia agencies. So this is something that anyone who goes to the primary healthcare level through the wellness center should be able to access labs and ultrasounds.
Okay.
For the pregnancy.
For the pregnancy. So expectant mothers have a little bit to worry about.
Yes.
When they're going
when it comes
through
to the pregnancy. Yes.
Excellent. I'm also reading here that we have a performance-based pilot project, PBS. Okay, could you tell us a little bit about that? What exactly is it all about?
The performance-based financing pilot project is a pilot project which actually is supposed to be a forerunner for UHC, where it's supposed lessons learned under that project should be incorporated into universal health coverage, which is the wider umbrella. That particular project takes into consideration screening of patients and screening of patients for hypertension and diabetes, and treatment of these patients for hypertension and diabetes. And that treatment will include lab tests at the wellness center at no cost to the patients, and medications for the patients at no cost to them.
Now, previously we were speaking about mothers.
Mothers. So this one is for hypertensive and diabetic cases. Yeah.
Okay.
It's a pilot and it's not all over the island. Initially, they started with 8 sites, and the sites they had chosen are more into the rural areas. And I mentioned you're looking at Dennery, Dennery Hospital, Reachford Wellness Center, Monipo, Deriso, Soufre, Lafag, Lakwamengo, and Jacmel. And that was phase 1. Out of that phase 1, they started in August of last year. If you look at the data from August of last year into March of this year, they would have seen 1,033 diabetic and hypertensive people. Okay? What they have done is they have expanded the service to 9 additional facilities to include phase 2, which have already started, to include Micoud and Tiroche and Delse and Montgouge, Etangs, Fosse-Jacques, Canaries, Ancillary, and Vanna Wellness Center. So if you go to the 17 wellness centers now, 8 in phase 1 and 9 in phase 2, you should be able to get screening to know if you are diabetic or hypertensive. And if you are hypertensive and diabetic, you will get what you call the medication at no cost to you, but the labs as well, the lab technologists or the phlebotomists will be coming down to the wellness centers to ensure that bloods are taken from you if necessary, if you are in these regions or these wellness centers.
Now, just before we take a break, over 4,000 laboratory tests have been done between when we started till August 2023?
Between the
initial stages of the PBF and up until August 2023.
Okay, yes.
With all of these tests that were done, the patients, because the biggest thing for a lot of them is I cannot afford the medication.
Yes.
These patients, are they afforded the opportunity to get medication for free, or they're referred to a doctor? What is the...
No. When you are a patient accessing under the PBF pilot, you see a physician, you are screened. If you are diabetic or hypertensive, you see a physician, and you also get your lab tests at no cost to you and your medication at no cost to you at the wellness center.
All right. And these wellness centers were what we just mentioned a while ago?
Yes. The 2 phases, they have those I mentioned in phase 1, and this is what the data we get from phase 1, and we have placed phase 2 on now. So you'll get more data on phase 2 after a period of time, because phase 2 just started with the second set of wellness centers I mentioned.
All right. We'll take a quick break, and when we return, we will have more with Dr. Ford. We will get into the launch of the cervical screening and the HPV testing. Of course, we have new technology using, and we will be interesting to hear more on that. So stay with us. We'll be back after these moments.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we save them? Chemicals and GMOs are not the solution. Revolution. Use organic, enjoy. Excessive agrochemical use, additives, and genetically modified foods are harmful to health and the environment. Join the Good Food Revolution. Grow, buy, and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP. The Good Food Revolution.
Welcome back. We are here discussing the new testing method for the cervical cancer and HPV screening. My guest today is Dr. Alicia Eugene Ford, the Director of Universal Health Coverage here in St. Lucia. So, Dr. Ford, we spoke at length about the UHC and also the PBS. Let's chat now about this new testing method that I read about for cervical cancer and also the HPV screening.
Yes. Okay, so first of all, I want persons to know that the World Health Organization is encouraging and pushing countries to try to eliminate cervical cancer by 2030. Okay, that's one of the things that
by
the World Health
2030?
Organization is pushing. Yes.
Okay.
Now, to be able to eliminate cervical cancer, you have to take into consideration a three-pronged approach. Vaccination, which is HPV vaccine, because cervical cancer is a sexually transmitted disease, caused by human papilloma virus. So therefore, you can pass on the virus through your sexual activity.
Okay.
All right. Persons have different types of sexual activities. They have transvaginal sex, which is basically what persons are cool with. But then there's anal sex, there's oral sex, which are different types of modalities of sexual activities. So HPV is real, and it is a causative agent for cervical cancer. So with the vaccination, the HPV vaccine, we are giving it to children from ages 10 to 12, with grade 6ers, boys and girls, and we're getting it from 2019. Okay? Currently, the Ministry of Health, we're trying to work to look at, we actually started the discussion to look at expanding the coverage to 26 years, male and female. Research has shown that it can be pushed up unto 46 years, one dose, and it will still be effective. This comes with financial implications, so therefore, as technical officers at the Ministry of Health, we have to look at it and come up with a costing so that we can see if the government will be able to go ahead with this request that we're requesting, we're asking for. But in the interim, we have started giving it to boys and girls at 10 to 12 years old, grade 6ers at the schools.
Okay.
Now, the second prong approach to cervical cancer elimination is screening. And we're using, we are going to talk a little bit about the technique in a short while, but also the third prong is treatment of precancerous and cancerous lesions. Okay? Now, for screening, which is the reason why we're really here today, we have a way of doing screening right now, and we've been doing it for years. We have Pap smear clinic around the island in all the wellness centers. They have their schedule, the days where they have their Pap smear clinic. Okay? But now we want to move from the method that we're using to a method that is more advanced, called liquid-based cytology. This method is not only allow you to know what strain of HPV you have, because we have not all strains of HPV cause cancer.
Okay.
We have certain strains that strain 16, strain 8, strain 1845, they give cancer. Okay? But not all strains.
Would cause it?
Usually, no, not all strains would cause it. And usually, we have HPV, but our body can deal with it.
So our body can fight it?
Our body can fight it, yes.
Okay.
But they have certain times our bodies cannot fight it, and we have some of them that they develop into cancer.
Understood.
Okay? All right. So it's important that we know the strain that's circulating, the strain that is prevalent, the strain that the patient has, to be able to do the necessaries to assist the patient before it gets worse. You can do proper monitoring and intervention when necessary. Okay? We also want persons to know that new technique will allow us to know other types of STDs if it's there.
Okay.
Whether it's trichomonas, syphilis, okay, chlamydia, all of this can be detected under that same sample. The method we're using now, we'll be using it, we put it on a glass, a slide, then they put it on a smear, spray it, and put a glass on it, a fixed spray it. But then by the time you transfer it to the lab, sometimes it breaks. And then you have to call back the lady and say, listen, I need to do a pap smear again because we broke your slide.
Right.
You understand? The labeling might be an issue. And also the persons at the lab, they would tell you, when they look at the smear, which is the glass under the microscope, it has a lot of debris. They see a lot of things which makes it difficult. But this new method, it's cleaner and clearer for them, making it easier for them to diagnose and give us the information. So when they go to the lab, the information we'll be getting from the lab would be easier for us to get more information for the patient. Tell them, listen, this is what you have. This is a strain of HPV. If there's another STD, they will let us know. And that is important. The lab has been informed in their engagement that they will be that, and we're going to engage 2 labs. And the reason why we're engaging these 2 labs is because they are the only ones that have the machines to process that type of test.
Okay.
They are the only ones on island. That is the Esdralong lab at the Millennium Heights Medical Complex and the Lab Consultations Limited. That will be Lab Services and Consultation Limited. That will be Dr. King's lab.
Yeah.
Okay, these are the 2 labs. So these labs would look at the data and ensure, look at the slides, and if it's an urgent, it's a non-urgent sample, they'll give us the results within 3 weeks to 4 weeks, a month. If it's an urgent sample, we need to get the results back within a week. And if it's a situation when they process it, they see something that's really not good, they need to call the physician and the wellness center or the facility within 1 day, within the same day.
Somebody can get the result within 1 day?
Somebody can get the results in 1 day, but it depends. If it's a non-urgent sample, a routine sample that the nurse is doing, they will get the results within 3 weeks to a month.
Okay.
If it's urgent, when the nurses say, listen, I need to get an urgent request on this, they get the results within the week. But the people at the lab, if they're processing and they're seeing something that's, hey, this is out of the way, they're not going to look at urgent or non-urgent. They're just going to call the doctor and the wellness center, say, this is an issue, and we need to deal with it. And that would happen within 24 hours.
24 hours.
So these are guidelines we've given the lab
Okay.
to expedite. Because what we do not want is for persons to do pap smears and stay such a long time to get the results. By the time they get the results, they would have been advanced in whatever level of illness they have. We don't want that.
Understood.
So we have to make sure the turnaround time on the results is important.
Because what I have learned about HPV especially is you don't even show signs.
Sometimes you don't show signs at all.
Yeah.
You understood? However, we want to let you know that when persons get cancer, then they start having all the symptoms and you understand?
Yes.
The women may complain about pelvic pain during intercourse and after or immediately after intercourse, excessive bleeding after menopause, bleeding between their period, which doesn't necessarily mean you have cervical cancer.
Yeah.
But then you have to check yourself to see. The doctor will tell you whether you actually go in that trend. And of course with the men, because you have HPV, it depends on what the man is doing. You can have anal cancer, you can have oral cancer where you have warts and you have other things in your genital area. You have other difficulty swallowing and coughing, depending on what part of the body that's been affected. Genital warts, etc., and cauliflower looking kind of genital warts. So it's important that we don't get to that point, that you try your best to get checked as a woman, going back to cervical cancer.
Yes.
If we can actually help you and prevent you from getting to that point where you advanced. Okay? So when the woman comes to the wellness center, and I want it to be really, I want the public to know, we would advise the women to call the wellness center, because this is a program we want to start in August.
Okay.
Okay?
That's
Next, August. So we want the women to call, once you roll it out in August, we want the women to call the wellness center. Call the wellness center and get to know when you are going to get, when is the pap smear, because not all the wellness centers have pap smear none of the wellness centers do pap smear clinic every day.
Okay.
They have different days. There's a high day when you come, there's hypertension and diabetes clinic, another day there's a pap smear clinic, another day when they have child, to see the children, mothers, they have days when they have podiatry, they have other clinics, you know. So you need to call your wellness center for you to know what day they're doing pap smears, and then you can come. We advise persons to walk with their ID cards to ensure that they are properly enrolled in the health management system, and then we'll be able to see, the nurse will see the patient. The labs that we have engaged, the 2 labs, they're providing kits so that nurses can do the test, but they're also going to provide courier services to take the samples from whichever wellness center on the day they have the pap smear and bring it back to them, process it, and ensure the results are back so that the patient can be seen and if necessary, sent to the colposcopy clinic. Okay?
Is that clinic here in St. Lucia or overseas?
We have colposcopy clinics in St. Lucia under primary health care, and we're looking at 3 areas to have the colposcopy clinics to be run by an obstetrician gynecologist. So far, we have colposcope machines that we place in Grosset Polyclinic, Ancillary Wellness Center, because we're looking at ancillary as a center of excellence for sexual reproductive health, and Zufort. Okay. We plan to do procure 3 additional colposcopes so we can put in Dennery, Soufrière, and the Castries Urban Polyclinic.
Okay.
Yeah.
So the 3 pillars, we have already spoken on them, and the Ministry of Health, Wellness, and LFS, they have that already marked out what they're going to do with it. For example, with the vaccination, we're looking at vaccinating as early as 15.
We have already started 10 to 12 years, boys and girls.
Okay.
Yeah.
And the screening. The screening.
To change the technique.
Yeah.
Yes.
Now that one for me is the new one that people may not be too familiar with, which you explained a while ago. What else are we looking at now with regards to eliminating?
Oh, it's the cervical. Okay, but just to add to what you were saying, that particular new technique, you don't have to come and do your pap smear every year.
Okay.
Yeah. Women can come every 5 years. And if it's a situation where there's an issue, the doctor and nurse would advise you to come every 3 years, depending on what they get, or between 3 to 5 years. So you don't have to come every year like we do in current method.
Currently.
Yeah, and there's less discomfort as well associated with that method for the women.
All right. Okay.
For precancerous and cancerous lesion, when you come to the colposcopy clinic, if you got that point and the results show that you have an issue, you'll be referred to the colposcopy clinic, and the colposcopy clinic, the doctor at the colposcopy clinic would then do the necessary for you for colposcope, and then if it's a situation you have cancer, they will be able to guide you, give you proper guidance through the system, to the oncology system for now. And I say for now because persons may be asking basically, and if I have cancer, are we being covered to continue?
Yes.
Currently, we're going to cover you up to colposcopy clinic. However, in the future, we are going to see how we are looking at expanding the basket in a phased manner. However, now, if you get to the colposcopy clinic and you need to be referred to oncology, we'll give you proper guidance or proper referral to the healthcare system.
Training.
Yes.
We are nearing the end of the program, but is training being provided for
the healthcare workers?
For the healthcare workers?
Yes, we are doing training. We started training. We've completed the training to a large extent for the healthcare workers on cervical cancer screening and HPV testing. We're doing some methanol spill training right now as we speak, because some of the kits have methanol, and if it spills, you have to know how to get rid of methanol or wood and alcohol. Okay, you have to do the necessaries. Remember the Coolitown situation?
Yes.
You have to know exactly how to get rid of it. So that training is ongoing. And but a lot of training has been done to prepare people. We also did a different training that is different, because we realized with all of this, we training clinical people. Let us train people from palliative care who take care of people at home, the home carers, because we know that cancer, not only cervical cancer, cancer on whole, you will have certain individuals who will reach the point where they need palliative care. You want them to live as long as possible, as well as possible. So we've been training the home carers as well, not only for cervical cancer, but for other types of cancer, because palliative care goes beyond just cancer. They have people that have diseases where they need palliative care to live as long as possible, as well as possible.
Doc, if people would like to find out more on what we just discussed today, where can they go? What can they do? Who can they call? Okay,
so if you want more information on what we discussed today, right now, you can call the Ministry of Health at 468-5300, 5300, or you can ask them to put you onto the Universal Health Coverage Unit. But also, any of the wellness centers on island would be able to give you information on the services that we have upcoming. I also want the persons to know that the St. Lucia Planned Parenthood is also on board. Okay, yes, they're not under the public healthcare system, and they work as a separate organization, but they will be given kits as well, so that persons accessing there can get the procedure done. I am not telling you they're not going to pay a fee for what other services that the St. Lucia Planned Parenthood provides. But at least for the kits and the processing of the kits, that should not be at any cost to the patient. However, we were asking patients who are going to access St. Lucia Planned Parenthood, there's a little form that we're going to be giving you. Please fill in the form, because when you fill in the form, you will be telling us that you want us to register you at your nearest wellness center. Just in case you go to the health center, we already have you registered. You can make your changes of your name, your next of kin, your number if you want to, but at least we'd have your information in there. Yes.
Okay. Well, thank you so much for joining the program today, Doc.
Thank
Folks,
you.
We've just had a chat with Dr. Alicia Eugene Ford, the Director of Universal Health Coverage, St. Lucia. We spoke extensively on the new method for testing for cervical cancer and HPV screening. If you need to get more information, of course, you can visit their social media pages as well as giving the unit a call. My name is Kendall Eugene. This has been Issues and Answers. Thank you for joining. Have a great day.
Thank you.